sharing a little bit today about trauma and the window of tolerance. When I work with children, there could be two different reactions in terms of overactivated or underactivated. So hypoarousal, which is like withdrawal or dissociative behaviours, or hyperarousal, which is overactivation, where the alarm state, there's fight, flight or freeze responses. When I'm helping a child process certain traumatic experiences, whether it's grief, losing a parent, or experiencing some kind of physical trauma, trauma comes in all different shapes and sizes, and it's relevant to how big the child perceives the trauma as to how significant and what the impact is, how much it affects them on a day-to-day basis. So children who experience PTSD from, history of family violence, they experience a range of symptoms that could be triggers throughout their days ongoing. And it's a matter of how do we work with these, how do we get to know what the body symptoms and signals are to create that awareness of what happens next in terms of what's my response, how to create that little bit of space for them to be mindful of what they're either going to do or say, and manage their behaviour in the best way possible. So that window of tolerance, when I work with a child, I make sure that we try and stay within that comfortable window, but also stretch them to a level to reprocess the trauma in a way that is important, that it gets reframed, that it gets re-narrated, a different story, and that their experience is heard, witnessed and processed in the way that they want it to be, with obviously the assistance of me as a therapist. Siegel coined this term, and it's a very useful term to understand in terms of when I talk to parents about behaviours of kids, where that behaviour lies. Does it lie, what their behaviour is a response to something that lies out of that window of tolerance. Hopefully that is expressed well, that you can understand the concept. Thank you for watching.